Irritable Bowel Syndrome, or IBS, is a common and often misunderstood disorder that affects the large intestine, also known as the colon. It impacts millions of people worldwide, regardless of age or background, and is one of the most frequent reasons people visit a doctor for digestive issues. Think of your colon as a long muscular tube that moves food, absorbs water and nutrients, and helps form waste. In a healthy colon, this process runs smoothly. But with IBS, the normal rhythm and contractions of the colon are disrupted, leading to a range of uncomfortable symptoms. This disruption can cause abdominal pain or cramping, bloating, excess gas, and noticeable changes in your bathroom habits, such as diarrhea, constipation, or sometimes both, often alternating. IBS is known as a functional disorder, which means that while the bowel looks completely normal on scans or tests, it doesn't always work the way it should. There's no visible damage, but the symptoms are very real. Importantly, IBS doesn't cause permanent harm to your intestines, nor does it increase your risk for serious diseases like cancer or inflammatory bowel disease. It's not life-threatening, but it can be life-altering. The main problem lies in the communication between your brain and your gut, a relationship called the brain-gut axis. When signals get mixed up, your digestive system can overreact to normal activities like eating or stress. In IBS, even normal sensations in the gut can feel unusually intense or painful. This is called visceral hypersensitivity, and it's a hallmark of the condition. Stress, anxiety, and strong emotions can trigger or worsen IBS symptoms, because your mental state has a direct impact on your gut's function. That's why managing stress is often a key part of treatment. IBS is a chronic condition, meaning symptoms can come and go over months or even years. Some days may be better than others, and flare-ups can happen unexpectedly. While it isn't dangerous, IBS can disrupt your daily life, making it hard to work, socialize, or enjoy activities you love. The good news is that with the right management, like dietary changes, stress reduction, and sometimes medication, you can control symptoms and greatly improve your quality of life. Remember, IBS is manageable, and you're not alone. Many people find support and relief by connecting with others and learning more about their condition. Understanding IBS is the first step toward taking control of your health and living well, even with the condition. IBS is far more common than you might think, affecting people from all walks of life, regardless of where they live or what they do. It's a condition that doesn't discriminate, touching the lives of millions across the globe. In fact, up to 15% of adults worldwide are affected by IBS, making it one of the most prevalent digestive disorders. That means in any crowded place, chances are several people are quietly dealing with IBS symptoms. IBS can begin at any stage of life, from childhood to late adulthood, but most people start noticing symptoms before they turn 50. Early signs can sometimes be subtle, making it easy to overlook until symptoms become more disruptive. Interestingly, women are about twice as likely as men to be diagnosed with IBS. This may be due to hormonal differences, but social and cultural factors could also play a role in how symptoms are reported and managed. IBS often runs in families, suggesting that genetics may influence your risk. If your parents or siblings have IBS, you might be more likely to experience it too. Having a close relative with IBS increases your risk, but it's not a certainty. Lifestyle, environment, and stress also play important roles in whether someone develops IBS. For some, IBS develops after a severe stomach infection. This is known as post-infectious IBS. Even after the infection clears, the gut can remain sensitive for months or even years. Stressful or traumatic life events, especially during childhood, can also increase your risk of developing IBS later on. Emotional well-being and gut health are closely linked. These factors highlight the strong connection between emotional health and gut function. Managing stress and seeking support can make a real difference in how symptoms are experienced. IBS is truly a global issue, affecting people in every country and culture. No matter where you are, you're part of a much larger community of people facing similar challenges. Remember, you're not alone in facing these challenges. There's support, understanding, and hope for everyone living with IBS. IBS symptoms vary widely from person to person, but abdominal pain or cramping is the most common and often the most distressing. This pain often improves after a bowel movement and can shift in location and intensity throughout the day. Changes in bowel habits are key indicators of IBS. Some people experience frequent diarrhea, known as IBS-D, while others suffer from constipation, referred to as IBS-C, and some alternate between both conditions, which is called IBS-M. Bloating and excess gas are frequent complaints, sometimes causing visible swelling and discomfort. These symptoms can be not only physically uncomfortable, but also socially awkward, affecting daily interactions. Many with IBS feel they haven't fully emptied their bowels, a sensation called incomplete evacuation, which can be very frustrating. Mucus in the stool is also a common symptom and can be alarming if you're not expecting it. While these symptoms are frustrating and can significantly impact quality of life, they're typical for IBS. However, if you notice rectal bleeding, unexplained weight loss, or severe pain at night, it's crucial to see your doctor immediately. These are not typical IBS symptoms and need further investigation to rule out other serious conditions. Recognizing your symptom pattern is key to effective management and can help you and your healthcare provider develop a tailored treatment plan. IBS is disruptive and can be challenging to live with, but it is not dangerous. With proper management, you can lead a full and active life. Diagnosing IBS relies on your medical history and symptom patterns. There's no single test for it. Doctors use the Roma-4 criteria, recurrent abdominal pain at least 1 day a week for 3 months, linked to bowel changes. They'll rule out other conditions like celiac disease or inflammatory bowel disease with blood or stool tests. Tests aren't to find IBS, but to exclude other causes. If you have unusual symptoms or red flags like bleeding or weight loss, further tests like a colonoscopy may be needed. If your tests are normal and your symptoms fit the criteria, IBS is the likely diagnosis. Open communication with your doctor is essential for accurate diagnosis. Managing IBS starts with diet and lifestyle changes. Keeping a food and symptom diary helps identify personal triggers. Adjusting fiber intake, more for constipation, less for diarrhea, can help. Eating smaller, frequent meals and avoiding gas-producing foods like beans and carbonated drinks is wise. The low FODMAP diet, guided by a dietitian, can be very effective for many. Regular exercise, such as walking or yoga, supports gut health and reduces stress. Prioritizing good sleep is crucial, as poor sleep can worsen symptoms. These changes empower you to take control of your IBS. Small, consistent adjustments can make a big difference. Stress is a major IBS trigger, so managing it is vital. Techniques like mindfulness, deep breathing, and cognitive behavioral therapy can help calm the brain-gut axis. For some, gut-directed hypnotherapy is effective. Medications may be used for tough symptoms, antidiarrheals for IBS-D, laxatives for IBS-C, and antispasmodics for pain. Probiotics, found in yogurt or supplements, may help some people by balancing gut bacteria. Finding the right probiotic can take time, so consult your doctor. Combining stress management, medication, and probiotics can provide significant relief. Treatment is personal. What works for one may not work for another. Work with your healthcare team to find your best plan. Living with IBS can be challenging, but it's manageable. Focus on building a long-term wellness plan, not searching for a quick cure. Learn your triggers and develop strategies that work for you. A supportive healthcare provider is key. Partner with them for ongoing care. Family, friends, and support groups can make a big difference. Flare-ups happen. Use them as learning opportunities, not setbacks. Celebrate small victories and be patient with yourself. IBS doesn't define you or your future. With the right approach, you can reduce symptoms and reclaim your quality of life. Self-care, understanding, and persistence are your best tools. You have the power to live well with IBS.